Thank you guys very much. I'm excited to be here and to share with you an exploration into how important sensory stimulation is in movement accuracy. So we're going to be looking at brain optimization. When you're looking at your athletes, your clients, and patients, I want you to be thinking of how important the brain is when it comes to their movement coordination and optimization. As was introduced and mentioned about me, is I am a podiatrist, but my take on podiatry is very challenging of, I guess, the norms of common podiatry. I look at every one of my patients from a very functional perspective. I look at most of their movement dysfunction from a sensory perspective. Biomechanics are really important in how we control and coordinate movement, but sensory is also important. So we're going to be focusing on that sensory aspect. Of course, we're going to be speaking about the feet, but I'm going to try to tie in the eyes, the ears, and the rest of the sensory system as well. I cannot proceed without thanking Perform Better for sponsoring me here at NSCA and their contributions through all of my education career. So we're going to be looking at the science of the somatosensory system. We will be mentioning Neboso a little bit. It's a brief introduction to me. So, a few things. Why is it important to understand the somatosensory system? Foundation concepts that we want to think about is, one, life is sensory. Sensory stimulation coordinates every single motor output of your system. So if you are not looking at movement from a sensory perspective, and you're just thinking of movement as joints and muscles and tendons that are moving, you are missing a huge part of how that movement is actually executed. So life is sensory is a huge belief with every single one of my patients and athletes. That sensory input shapes our motor system. So if you take the feet just as an example, you have 10 times as many sensory nerves as motor nerves in your feet. Which means when you think of the feet, I want you to think of them as a sensory gateway into your nervous system. Don't just think pronation and supination and dorsiflexion. I want you to think of sensory gateway. How can I tap into those critical nerves that are in the skin in the bottom of the feet? From an evolution perspective, the skin in the bottom of the feet shaped the entire nervous system. It helped to shape the brain. Our brain evolution was timed with the coordination of upright bipedalism. So you want to be taking that into all of your athletes and your appreciation of movement. We're going to be looking at feet, hands, and the mouth and how they're these sensory gateways into the nervous system. And then any deficit in sensory, how does that create a compensation, dysfunction, and pain? So to be looking at movement from a brain optimization perspective, I want to make sure that we all have a baseline understanding of the brain. So we're going to be looking at what's called the Triune brain theory. Now, the most important thing when you think of the brain is that we break it down into three main divisions. You have your reptilian brain, which is your brain stem. You have your early mammalian brain, which is the limbic system. And then you have your mammalian brain, your new mammalian brain, which is the neocortex. Now, you must go through each of these to get to the neocortex. The neocortex is where you house your somatosensory system and your motor cortex, premotor cortex and motor cortex. So you must go boom, 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 not just straight into the motor cortex. So your reptilian brain, think of this as the autonomic nervous system, your survival aspect of the brain. This is where your baseline needs are met through this brain stem. So when you shift into, let's say, a traumatic situation, any sort of PTSD or anxiety, you are down-regulating and you are functioning primarily from this reptilian survival brain. If any of your athletes are in a stressed out position or have experienced any sort of trauma, have anxiety, PTSD, etc., they're functioning primarily out of this. Which means if you're trying to correct their motor dysfunction and you don't get them out of their survival state, it's not going to stick. That's a huge aspect of my practice. This is where your brain stem is. Now there's a part of the brain stem that I want to focus on. This is called the reticular activating system. Is anyone familiar with the reticular activating system? Okay, awesome if you are. If not, here we go. So reticular activating system, this is the part of the brainstem that controls your sleep-wake cycles, but is really what is the ignition to your brain. So if you're thinking, I want to enhance my athlete's movement accuracy through brain optimization, their brain has to be online. I need to make sure that their brain is awake. So you are tapping into the reticular activating system. What's fascinating is that your reticular activating system is linked to the vision system and the vestibular system. So if you're trying to turn on your athletes or your clients' brains, are there little things that you could do to kind of hack into their reticular activating system? 100% you can. So the reticular activating system is considered cholinergic. If you've heard of the term cholinergic, anytime you think of that, you want to think of wake up, stimulate brain. When something is cholinergic, it is increasing the neurotransmitter acetylcholine. Acetylcholine is used by your muscles for movement. It is used for the control of the autonomic nervous system. It is controlled in how you stimulate memory and motivation, and it's used to control how you breathe. So it's a critical neurotransmitter. Think of baseline survival. This is how you can tap into your reticular activating system, waking up the brain. When you yawn, you are essentially stimulating the tongue ligaments. Your tongue ligaments are actually connected to your vestibular system. So when you yawn, or if you just want to put the tongue into the palate, you will stimulate the tongue ligaments and wake up the brain. You can also do infinity signs, which I will talk about that more in a little bit. But when you do infinity signs, you're essentially crossing the midline, which is waking up the brain as well. You can rub the outer side of the ear, and that will also stimulate the vestibular system. So if you yawn and you rub the outside of your ear, you're essentially waking up the brain. Next, we go into your early mammalian brain, which is your limbic system. This is huge, hugely critical. If you're familiar with the limbic system, or you possibly heard this tossed around, you might think of it as your emotional center. Your limbic system is emotion, but there's a side of emotion that I want you to think about, particularly in movement, and that's motivation. So to motivate your clients or your athletes or patients is they have to be tapping into their limbic system, or it's housed within the limbic system. So your limbic system is broken down into the thalamus, hypothalamus, basal ganglia, amygdala, that's your heavy emotion, and then the hippocampus. That's where your limbic system is. Now, super quick going through this. Thalamus, this is the relay station for all of your senses. Every sensory stimulation that comes in outside of smell must pass through your limbic system. To go through your limbic system, you must first go through your brainstem, which means your brain has to be awake, right? So reticular activating system must be up. Your hypothalamus, this is where you're controlling temperature, but this is also what is linked to your HPA axis. So stress and cortisol release. That is through your hypothalamus or the HPA axis. I'll mention that in 1 second. Basal ganglia, this is your movement center of your limbic system. Why I emphasize this is because your basal ganglia links to not just voluntary large movements, but also to fine motor movements such as those with the eyes. So if you do eye movement exercises, I know there's a few lectures on the schedule that relate to vestibular and vision. If you do eye movement exercises, you are tapping into their basal ganglia, which is actually improving their gross voluntary movement. There's really cool research around Parkinson's and MS and post-stroke and different neurological conditions. And if you incorporate eye movement exercises, you can actually improve their balance, reduce falls, gross motor coordination. Amygdala, heavy emotion. Not going to go too far into that. I've done other lectures on emotion and interoception. The hippocampus, this is going to be your memory. So real quick, I just feel like I have to mention this because the hypothalamus is mentioned. So your HPA axis. This is where you're getting your cortisol release. Why I mention this is because if you have elevated chronic cortisol release and stimulation of your HPA axis, even if you're overtraining, you are down-regulating your hippocampus. Your hippocampus is very sensitive to cortisol. So anyone who is experiencing anxiety, depression, PTSD, overtraining, stress, type A personality, they are actually down-regulating and damaging their hippocampus. Now, the hippocampus, which is your memory, if you've ever been in like a stressed out situation and then someone tries to ask you something and you try to do memory recall, your brain is just like a big fog. That's because of the cortisol and what it does to the hippocampus. Now, going back. The number one way to stimulate your hippocampus, does anyone know? To repair, regenerate, and stimulate new nerve synapses of your hippocampus. It is exercise. Aerobic exercise is one of the best ways to stimulate the hippocampus, which is your memory. Finally, we go forward into your neocortex. This is your command central. This is obviously where we're going to have our motor cortex and our premotor cortex. This is the neocortex. Now, I want to mention the corpus callosum. So this is what is connecting both hemispheres. So not only do you have to have your reticular activating system online, but you need both of your hemispheres online. So you need to either stimulate the tongue ligaments, use the eyes, do eye movements, rub outside the ear to get the reticular activating system online, and then you need to get both hemispheres. Now, the way that you stimulate your corpus callosum is, can anyone guess? Anything that crosses your midline. So if anyone does crawling patterns with their clients or their athletes, you're essentially stimulating both hemispheres. You're getting both hemispheres online. If you don't do crawling patterns or cross-body patterns, you can do any of these things. You could just have your athlete stand like this. They might not enjoy it, but it is stimulating and getting both hemispheres online. The infinity is very cool. If you either take a pen and draw an infinity, and you're following it with your head and your eyes, or you can keep your head and then just follow it with your eyes. You're stimulating eyes, which is linked to reticular activating system, and you're crossing the body, which is stimulating both hemispheres. You can do it holding something, you can draw and do it, or you can do it in the air, and you want to do both hands. It is a way to get you back online. So we're going into really what the focus of this lecture is. Life is sensory. When you are doing any sort of reset, rehabilitation, neuroactivation, movement prep, your goal should be optimizing the sensory stimulation of that athlete and the client. Now that means eyes, ears, skin, sound. You want to stimulate all of those gateways. So sensory input is so important that it begins in utero. Can anyone guess the first sensory system to form in utero? Most people think touch. It's actually not touch. It's your vestibular system. So the vestibular system is critical to the way that your body controls upright movement. We set our relationship to gravity through our vestibular system. And then your vestibular system is linked to postural muscles, to core muscles, to the eyes, to the hands. So everything is linked, but that is your baseline. You're setting your pattern through the vestibular system. So when you're looking at dynamic control, movement accuracy, any vestibular resets and exercises, huge. I know, again, those were on the schedule as well. Your visual system, hugely critical as well. There's a unique association between vision and touch. So if you ever look at a baby when they're learning things and you tell them that is speaker, they want to touch the speaker. It is how your brain actually creates these neurosynapses and creates those patterns. So there's a deep link between vision and touch. And then, of course, we have to focus on touch. So your proprioceptive system, your mechanoreceptor system of your hands and your feet. This is what I focus on primarily in my practice, is the power of touch. So all of your touch goes from your brainstem through your limbic system, thalamus specifically, and then into your somatosensory system, which is part of your neocortex. If your brain is not online, if the reticular activating system is not online, let's say that athlete is in a survival state. Their autonomic nervous system is not balanced. Most of my patients with chronic pain, they're in a survival state. Where my role comes in is I can't help them until they get out of that survival state. Then I use the rest of the sensory system to shape their motor programming. Touch is considered cholinergic, which means it's going to increase acetylcholine. It's going to wake up the brain. This bottom one here, very fascinating. So it's saying that a decrease in touch Now, not just what I touch, but someone touching me, right? Touch goes both ways. So us touching client and then client touching things. A decrease in touch has been associated with a decrease in reticular activating system activity, decreased and compromised learning, compromised affect, which is your emotion, and compromised movement. So in children who do not get enough touch, they have a great deficit in their emotional control, their intellectual control, and their motor coordination, because touch is so powerful. So when we look at touch, your hands and your feet, so the skin on the palms of the hands and the skin on the bottom of the feet is considered glabrous skin. It is packed with haptic or touch receptors. Now, between your hands and your hands are much more sensitive. I wish your feet were more sensitive because it would build my case. However, your hands are much more sensitive than your feet. You have 17,000 mechanoreceptors in your hand. You have 104 in your feet. I wish there was more in the feet. However, you still have thousands of nerves in the feet. They just are not mechanoreceptors. They might be nociceptors, thermoceptors. So you do still have more nerves in the feet. Now, when it comes to the feet, you have a higher concentration of mechanoreceptors on the lateral or the outside of the foot. Makes sense. And you have few or very, very seldom mechanoreceptors in the medial arch. Again, that makes sense because your medial arch technically should not be on the ground. From an evolution perspective, the arches are critical to bipedalism. So, I'm not sure if everyone has heard of the homunculus. This is a rendition of the homunculus. Now, the homunculus is essentially the way that your brain sees movement, the way that your brain sees the external world from a touch perspective. Now, on this homunculus, the areas that are the largest have the highest afferent input, which means they are shaping movement and the coordination and accuracy of that movement. We see the hands, we see the feet, and we see the mouth. So those areas, that makes sense of why a baby is putting everything in their mouth. They put their feet in their mouth, their hands in the mouth. Every object is going in the mouth because that's how they're starting to shape their perception of the external world. We now, as adults, we're using more of our hands and our feet. So when we look at the sensory nerves of your feet, your hands, your human body, you have four main types. You have nociceptors, thermoceptors, mechanoreceptors, and proprioceptors. So a lot of people will kind of misuse the term of proprioceptors when they talk about barefoot training. I will often use it as well because it's just more highly understood, that term. It's actually mechanoreceptors that you're stimulating on the feet and the hands. And that's what we're going to be focusing on. So haptic or touch receptors. Now you can break these four nerves down into two main categories. The ones that are on the left, mechanoreceptors and proprioceptors, those are used for movement. That is your somatosensory system. On the other side, you have nociceptors and thermoceptors, which are free nerves. So we can break them down a little bit differently. Your mechanoreceptors, you can break them down even further into four more. Your SA1, which is called a Merkel disc, is sensitive to 2-point discrimination. The spatial acuity of a 2-point discrimination or the Merkel disc is 1 millimeter. So if you guys are familiar with Braille, essentially Braille is stimulating on the hand the SA1 Merkel disc. It is the most superficial mechanoreceptor in the hands and the feet. That is how your brain perceives texture. We'll talk about noboso in a moment, but noboso is essentially a SA1 Merkel disc stimulating mat or surface. You have SA2, which is a Ruffini ending. This is stretch. So when you are on a texture, a rough surface, you are also stimulating stretch, which is having a control in that dynamic movement. And then finally, you have FA1 and FA2. Both of those are sensitive to vibration. 70% of the mechanoreceptors in your feet, if you look at these four, are the bottom two. 70% are sensitive to vibration. The sensitivity of these nerves in the bottom of your feet, peak sensitivity is age 40. By the time you are 70, you need twice the stimulation to create the same response. Your brain uses vibration to control dynamic balance when you walk. So if you start to lose the connection to these mechanoreceptors in the bottom of the feet, you start to compromise the balance and dynamic stabilization in clients, athletes, and patients. As we age and you stay disconnected, this is one of the biggest contributors to falls. There's research that shows after an ankle sprain, not only do you disrupt the proprioceptors of the peroneals and you delay peroneal reaction time, but you have a delay and a disruption in the mechanoreceptor sensitivity, which means part of ankle rehab programming should be stimulating these nerves in the bottom of the feet. So how you stimulate the feet is very important. The surfaces that you train on are very important because you want to optimize these receptors. So now this is the distribution of each. SA1, you can see that it's on the pointer finger. That's where you're reading Braille usually, right? So you can see some of the different distribution of the mechanoreceptors. I want to focus a little bit more on the feet. Here's the feet. This is the distribution of the receptors in the bottom of the feet. So if you look at SA1, that's your 2-point discrimination. SA2, that is your skin stretch. FA1, that is your low frequency vibration. Do you see how concentrated that is? That's one of the highest concentrations. FA1, low frequency vibration. FA2, high frequency vibration. You can see that it is centered on the ball of the foot, which makes sense because that is the landing pad of the foot. So when you jump and you land, you should be hitting that part of your foot, and that's where you're getting high frequency vibration. This is showing a cross section, and it shows from superficial to deep. The biggest takeaway on this is that your SA1 Merkel disc 2-point discrimination is the most superficial. The deepest mechanoreceptors are the ones that are sensitive to high frequency vibration and to skin stretch. I'm going to talk about the fascial system in a moment. So sensory stimulation with Nervoso. Nervoso is a mechanoreceptor surface, insoles as well, that I developed as a way to hack into the somatosensory system through the skin in the bottom of the feet. We have the mats that are around if you want to after I'm done speaking. You can go try the mat, stimulate on the mat. We also have a booth so that you can see and experience Nervoso. This is essentially Braille for your feet. When you look at the research of texture and what it does to the nervous system, what it does to the control of dynamic movement, it is very fascinating. These I'm going to show you probably 3 or 4. They're related to sports, but there's a wide array of textured insole research. The first study is looking at textured insoles in rowers. And what they saw is that there was a more accurate weight bearing when they used textured insoles in rowers. So the more accurate that the foot placement is, the better the recruitment of the hip muscles and the better force production. This one is looking at football players, soccer players, American football, looking at textured insoles and balance. This was actually putting the textured insoles into their cleats and using texture in a shoe that is usually very passive. Cleats and skates and ski boots, a lot of the athletic footwear is actually very passive and is deactivating to the nervous system of the athletes. If you're thinking of the importance of moving the foot and connecting the foot and stimulating the foot, and then you put your athlete in a shoe or a boot that is stiff and rigid and doesn't flex, yes, they need that for their sport, but how can we somehow keep that foot alive while they're in the shoe or before they go in the shoe so that they can stay connected to their foundation with the ground? So this was showing improved stimulation and balance through textured insoles in cleats. This one is looking at textured insoles following an ACL reconstruction. And they saw a faster joint position sense using textured insoles. So the benefits of textured insoles is not just foot specific. It doesn't mean that they're just going to feel their ankle faster. They will be feeling much more proximal faster as well, because the entire nervous system and fascial system is connected. So post-injury recovery is another role of texture and stimulation. This one was really interesting. Textured insoles reduce vertical loading rate and increased plantar sensation when running. So one of the biggest concerns with running is overuse injury risk, uncontrolled impact forces, repetitive impact forces. Putting textured insoles into their shoes decreased the impact forces that were coming in, which means that you are essentially improving the accuracy of their foot placement. If you can control the impact forces coming in, you're probably controlling the impact going out. So how does your exteroceptive system connect to your internal movement accuracy? So everything that I was speaking was related to the external world. However, your perception to the external world ultimately has to go in and coordinate internally for movement. So where is that connection? What is the connector between external and internal? Can anyone guess? Starts with an F, your fascia. Your fascial web is connecting your external mechanoreceptor world into the internal proprioceptive world of the joint capsules, the tendons, the ligaments, your fascia, and it is bringing that intercoordination between sensory out, sensory in. So your fascia forms the largest system in the body and is a system that touches all other systems. In the foot, your plantar fascia, which we think of as a strong band of tissue on the bottom of the foot, windlass mechanism, inversion of the rear foot, power, elastic spring effect, is also a spider web into your connective tissue of your skin. It actually blends and goes directly into your skin. So every movement of the external skin, any stimulation of the external skin is actually tapping into your plantar fascia. And then your plantar fascia spider webs into all of the digits, into the deep metatarsal ligament. So you do have this deep spider web. So your fascia is packed with sensory nerves. You have over 100 million sensory nerves in your fascial system. So when you think of the fascial web and tensegrity and anatomy trains and Thomas Myers and all of the fascial research that is out there, you want to be thinking of it as sensory tissue. It is the gateway into the brain as well. It is an extension of your brain and is part of how you are controlling movement. Stimulation of the hands is deeply linked to stimulation of your fascial system. If you remember the mechanoreceptors that we mentioned, you actually have 2 of those mechanoreceptors in your fascia. So you have the Ruffini ending, which is your stretch reflex. The Ruffini ending and the stretch reflex actually down-regulates the sympathetic nervous system. So when you go and you get a massage, they're essentially stimulating the Ruffini endings, which is down-regulating and is helping to put you in a parasympathetic, relaxed state. You also have what are called Pacinian corpuscles, or high-frequency vibration receptors in your fascia. So your entire fascial web is sensitive to vibration. The dynamic movement is stimulating the vibration of your feet, your hands, and your fascial web. They are talking to each other to coordinate and improve movement accuracy. So we influence fascia through the stimulation of dynamic movement. The stimulation of dynamic movement is impact. Impact forces is what's feeding your somatosensory system. So how you optimize their perception of impact is very important. If you are blocking their perception in any way, or they have a compromised ability to perceive impact forces, it will ultimately translate into a decrease in movement accuracy. So in order to understand how we control impact forces, we need to know how your brain actually perceives impact forces, which is Pacinian corpuscle vibration. So impact forces are the stimulation of dynamic movement. Those impact forces are perceived by your nervous system as vibration. Your feet, 70% of the nerves in the bottom of the feet are sensitive to vibration. Your fascia, fascial web, is sensitive to vibration. So when you look at the surfaces that your athletes are training on, or you're looking at their shoes, you want to ask yourself, is either that surface or those shoes blocking their ability to perceive vibration? If you put a lot of cushion in the shoes, you are essentially taking away vibration. If the shoe is absorbing the vibration, the shoe just took your brain's perception of that movement, which means you have a choice. You either get more information, which means you strike the ground harder, or you create a movement pattern without that information. If you create a movement pattern without that information, that usually creates a delayed reaction, a delayed coordination in their reaction. Most of my patients that have plantar fasciitis, Achilles tendonitis, shin splints, stress fractures, essentially almost every podiatric injury, is a disconnect from the ground, a delayed reaction to the ground, an altered perception to the ground, which is why I've built my practice around sensory to reconnect them into the foundation of functional movement, which is the ground, right? Gravity in the ground. So, thinking of perhaps they need stimulation of their feet and the ground before they go into their shoes, right? Now, we perceive impact forces as vibration. Now, the way that you load and absorb those vibrations is very important. That's going to be the link between stimulation and fascia. Because your goal is ultimately, how can I connect my hands and my feet with the fascial web of my body? That connection is through impact and vibration. So when vibration comes in, you have to absorb it and load it somehow. The way that you load it, I want you to think of vibrations, and if you had two cymbals and they're vibrating, or you had a tuning fork and it was vibrating, how would you stop that from vibrating? I'm assuming you would say you would contract into it, right? You would touch it, you would brace into it. So I want you to think that same thing with your body, with your myofascial system, is as vibration is coming in, your neuromuscular system is going to brace against it, contract against it, create a tensioning, stiffening effect against it, so that the vibration doesn't come through uncontrolled. Uncontrolled vibrations goes into your connective tissue and into your bone. Uncontrolled vibration is what leads to plantar fasciitis and stress fractures and every other injury I mentioned. So the ability to respond and brace into that vibration is very important. Now, the way that you do that, according to the muscle tuning theory in Dr. Neig, is based around isometrics. The isometric contraction of your lower extremity creates a stiffening or a bracing effect against the ground. Now, the one thing that I did not mention has to do with the timing of impact forces. When we walk, you are encountering 1.5 times your body weight in impact forces. Impact forces that are coming in less than 50 milliseconds. When you run, you are encountering 3 to 4 times your body weight. 3 to 4 times your body weight that is coming in less than 20 milliseconds. Your fast twitch muscle fibers do not reach their peak contraction until 70 milliseconds, which means even walking, you cannot react to impact. You must be anticipating impact. Your nervous system must be able to anticipate the vibrations that it's about to encounter repetitively 20,000 times a day so that it does not get injured. That is only shaped by it being able to perceive the vibration that's coming in. You put cushion in shoes, you start to create a disconnect. So, This muscle tuning theory that I'm going into, this stiffening response based off of isometric contractions, has to be happening before your foot even hits the ground. So your nervous system priming, your activation exercises should be done barefoot to wake up that entire sensory system, to wake up the anticipatory effect of the nervous system. So when you contract your muscles isometrically, they have an effect on your fascia. One of the easiest examples to understand to this is if you do an abdominal brace or you engage your TVA. When you engage your TVA, you should feel some sort of sensation. That is an isometric contraction that you just did. If you contract, engage isometric, you should feel what I call tension. When you look at fascial research, they reference tension and compression. Those are your choices within this myofascial web. So you are feeling tensioning responses to isometric contraction. Tension equals stiffness and stable. So if you are able to contract your lower extremity, your foot and lower leg, isometrically before you hit the ground, you are now sufficiently stiff to absorb those vibrations. Now, the other thing that happens when you do isometric contractions is that you increase compartment pressure. So if we go back to our abdominals and our TVA, deep obliques, we want to think of this as like a big compartment. When you do isometric co-contractions of the abdomen, you are increasing intra-abdominal pressure. That's essentially the point of why you're doing this, right? You get that same effect in these compartments. In these compartments. You have 4 compartments in your lower leg. You have 9 in your feet, which means that the purpose of your foot is to be a very rapid, stiff structure. Foot mobility is important, but your foot is designed to absorb impact and then release it as energy. It is absorbing and it's a lever. So it needs to be quick at becoming stiff. So isometric contractions increase compartment pressure. That is really what the muscle tuning theory is saying, is that you tune your compartments to the vibration of the frequency of impact forces and the ground. So if you ever use compression sleeves, essentially what compression sleeves are doing is that they are increasing the baseline compartment pressure of the lower leg, which means that the muscles do not have to react as quick. So you're offsetting fatigue, which is great. Now, one last thing that I want to mention, which kind of hits the muscle tuning theory home, is what you anticipate that's coming in must match what's actually coming in, right? So if you have a mismatch, if you think X is coming in and Y actually comes in, you have a mismatch. Now you have uncontrolled vibrations coming in and you start to get shin splints, right? So it's the accuracy of your perception that is important. So Dr. Neig, in his book, he references this story. If anyone has taken any of the lectures with me, you'll know my Cirque du Soleil story. Soon you'll be able to start sharing it. So Cirque du Soleil, I'm sure you're familiar with it. Cirque du Soleil has a very low injury rate. The way that they choose their athletes is extremely precise. The Cirque du Soleil facility in Los Angeles got a brand new stage. All of a sudden, their athletes were getting shin splints, plantar fasciitis, Achilles tendonitis. And they're like, what's going on? We don't get these overuse injuries. So they brought Dr. Neig down. He looked at their stage, and he saw that every so many feet, there was a support beam. Support beam. Which means that as the athlete was tumbling and doing their high impact forces, if they expected to land on no beam, and they landed on the beam, there was a mismatch between what they anticipated and what actually came in. So what they did is they took away all the support beams, tested the entire stage, made sure that every inch of that stage had the exact same frequency. All their injuries went away. Which seems like, whoa, that's cool. How do I use that, right? I use that in my office primarily with runners. And when a runner is continuously switching surfaces, if a runner is going from outdoor to an indoor track. If they're going from a treadmill to outdoors, from the street to the trail, you're essentially not allowing the adaptation of your nervous system. There is a small period of an inaccuracy of what's being perceived and what's actually coming in. So as an athlete switches surfaces, they need to decrease the stimulation. You can't say, well, I run 5 miles every day, so when I switch from outside to indoor, I'm going to run those same 5 miles because that's my cardiovascular endurance. No, your neuromuscular coordination cannot handle 5 miles when you just switched surface. So see how you can kind of play with that. One other real quick example is I was in Australia and I was telling the Cirque du Soleil story, and the Australian Football League, one of their strength coaches was in my lecture, and he said, you know what, we got this brand new field. We switched fields, new field, and as soon as we switched, the athletes started complaining that they just, like they weren't like working with the ground as much, like they were starting to get fatigued more and starting to get a little bit of foot pain. And the difference between the new field and the old field is that the new field had a parking garage under it. Makes sense. Concrete does not vibrate. So you are going to get a different vibration frequency if you are on concrete versus on wood. So when you're looking at surfaces, there is a deep symbiotic relationship between you and the ground. When you think of surfaces to train on, you want to think, when you strike the surface, it needs to vibrate and you need to vibrate. If you strike a surface and the surface is not vibrating, you get a back reverberation, right? We need to be essentially dancing with the ground. There has to be a flex in both directions. Okay, so concrete, probably the worst to train on. That's why they put rubber on concrete. But then the rubber, if you go too thick, just took all of your impact forces. So now what are you working with as well? If you are not working with the vibrations and how your fascia loads the vibration, you are not recoiling like a rubber band. If you are not a rubber band and you use brute muscle force, what starts to happen when you do repetitive patterns? You get tired. When you get tired and fatigued, that's where you start to get your injuries. And those injuries are going to be in the tendon, myotendon attachments, because you're pulling through muscle force. So there's this intimate relationship between sensory stimulation, the sensory stimulation of dynamic movement, and the human fascial system. Sensory drives motor accuracy. We are trying to tap into the motor coordination and the movement programming of our athletes, whether they're injured or we're just trying to optimize and get them to the next level. Are we doing it through a sensory perspective? Are we doing it through an understanding of the brain? Is their brain even online? Are they stuck in a survival state? Is that sensory stimulation getting past their limbic system into the motor cortex? Can you hack that activation somehow? And then when that brain is awake, how can you optimize the eyes and the ears and the hands and the feet by understanding the mechanoreceptors and by understanding surfaces and footwear? One of the best ways to use this is, again, in movement prep. Activation of the nervous system. You're slapping it awake or you're turning on the light switches that need to be on so that they can optimize that workout. If anyone is interested in trying the Nervosa mats, you have to take off your shoes and socks. They have mats, or we have mats along the inside, and then we have some that are up here, and they're also in the booth. I will take a couple questions if anyone has any. Okay, so he asked about orthotics and the use of orthotics. So There is research, it goes both ways. So there's research around chronic use of orthotics and never getting out of them. Chronically being in shoes that are stiff and don't have torsion in them. So if you're trying to optimize the movement of the foot, you should be able to wring out the shoe. Chronically supportive orthotics actually atrophies the intrinsic muscles of the feet. Now, when it comes to the stiffening response that I was speaking about and the compartment pressure that we need when we strike the ground, the 9 compartments that are in the foot are made of the intrinsics. So if your intrinsics are atrophying or they're slowing down, your foot is not going to be sufficiently stiff. So if you use orthotics, you still need time that is out of the orthotic and getting stimulation. Orthotics are highly overprescribed. Surprise. Not telling you something that you probably knew. They're highly, highly overprescribed. Now, some feet actually do need orthotics. A majority of feet do not need orthotics. If you are not focusing on foot strengthening and foot recovery, and you just go to the rest of the body, and the poor foot is not getting any attention, they will start to get foot fatigue, and then they will start to need orthotics, and now they become dependent on the orthotics, and they'll never be able to get out of them. So it depends on your take with that. I hope that answers your question. The other thing is that there's research that compares smooth insoles with textured insoles, and you get higher stimulation with a texture. So if you needed an orthotic, what if you added some sort of texture to that orthotic to help keep the foot alive while it is in that passive device? That's a thought as well. There was another question. Yes, so my answer in 2 ways. So when you're switching surfaces, think of that adaptation period, right? So when athletes go to the Olympics, there's kind of that pre-2-week window where everyone's training on the surfaces, right? Because every surface is a little bit different. Every turf on every field is slightly different. So a big part of like home advantage is not just that you have more fans in the audience, but your nervous system is actually tuned to the surface that that athlete is training on, whether it's the field or the court or the beam or whatever it is, right? So if you're switching within your same home field, court, and that, is do the movement prep on that surface. Take the shoes off and do the movement prep on the basketball court. Do the movement prep on the football field. Get their nervous system primed. If it's a new surface and they're switching, you got to slowly break them into it. Now, one thing that I will mention that is similar, pseudo-similar, is I'm a huge advocate of barefoot training. I'm also a huge advocate of minimal training. There's interesting research that shows that there's the lowest injury risk in those that do, say, X movements barefoot. Put on minimal shoes, put on whatever their athletic shoes are, whether it's a cleat or a basketball shoe, which means that you get a carryover into this different environment. I'm great and super stable barefoot. As soon as I put on shoes, I actually start to lose my control, which means I should actually train in shoes more. Does that make sense? Right? So you want to see that carryover. Get them into all the environments. Get them to do the balance and the activations in their cleats, with a vibram, barefoot, on different surfaces. Okay? So I do not have time for any more questions. However, I will be out. Again, if anyone wants to try the Naboso mats, they're along this way. And then we are doing a special gift, which is my book, which is called Barefoot Strong, Secrets to Movement Longevity. It's essentially everything, cliff note of what I believe in and how I treat my patients. We have 35 of these that if you go to our booth, the Naboso booth, you get a free copy. Thank you guys very much.